Hi everyone, my name is Melissa Heinlein. I'm the Chief of Voluntary Service at the VA Medical Center in Philadelphia, also really known as the Corporal Michael J. Crescent's VA Medical Center. Today, this short presentation is just to get you acclimated to our medical center, know a little bit about it so that we can prepare you for the My Life, My Story program. This is just a list of our voluntary service team. You'll see everyone listed here, but know that this is a group email, so you can just email if you have any questions or concerns, and everyone on this list will receive it. This is in the event that if I'm out or someone else, the communication can keep flowing. The phone number that is listed below is directly going into our office when you call. This is just the lineup of what we're going to be just going through with you this morning pretty quickly, so you'll be able to go back to the slides and see if there was anything that you missed. So the mission of Veteran Affairs is to provide and to honor America's veterans by providing exceptional health care that improves their health and well-being. Not only are we seeing patients, inpatients, outpatients, but we also do a lot with whole health initiatives, things such as yoga and Tai Chi, healthy eating and living for our veterans. From the time someone's discharged in the military, we can see them for the next 75 to 80 years. This is a picture of what our medical center looks like. We currently have 135 beds in our hospital, 120 at our nursing home, 40 beds at our residential treatment center called the Snyder House. And then we also have community-based outpatient clinics where veterans can also receive care if they didn't want to come back into the city, both located in our catchment area for Pennsylvania and New Jersey, plus 4 vet centers and a multi-service center. Also connected, just like Congress, different branches of the government. We have different branches here in VA. So we have the Veterans Benefit Administration, the National Cemetery Administration, which is a beautiful cemetery up in Bucks County. And many VAs are affiliated with a major university, and we are affiliated with the University of Pennsylvania. So our doctors and nurses have dual appointments. This is just a list of the Voluntary Service Department of what we cover and how we're able to support our volunteers. Unlike the private sector, we do accept and process donations, and we also support the medical center with their events, but then also our own. Unfortunately, in this day and age, we do have to talk about sexual harassment. So just like we share this with our new employees coming on board and regular training, we also do the same for our volunteers. Unfortunately, we've had some situations over the years where volunteers were doing some advances or, some kidding and teasing with staff that just was not tolerated. This is just a list of the types of volunteer opportunities that we have, but for the purposes of this, you will be doing the My Life, My Story program. But, if and when things do go back to the old normal, every volunteer assignment involves a high degree of patient experience. So you can always consider coming on board in one of these areas. So the type of volunteer we're seeking is someone who can work independently, being customer service focused, committed to maintaining a consistent schedule, strong communication skills, looking to have fun as a volunteer, but most importantly, serving veterans to the best of your ability. And if you're not able to give time, we do have opportunities to donate. We support both monetary and gift in kinds. We maintain an updated needs list that's reviewed regularly, an Adopt a Veteran holiday program, and some people in their communities even host a drive. This link we're going to ask you to review on your own. It is a quick video by the Cleveland Clinic for the Human Connection and knowing that everybody has a story. Our volunteers have stories, our veterans, our patients, and our staff. But what we want you to get out of that video is that all volunteer assignments are essential, but we don't want you to be the one to forget about the patient experience, whether that be face-to-face or virtual. We also work closely with our suicide prevention team, and if you know that there are many veterans, unfortunately, who are committing suicide each day, so we ask that volunteers put this website in their phone as well as the phone number. We encourage you to do this. You never know who you're going to come up, and interact with. But unfortunately, there are about 22 veterans who commit suicide today, and that unfortunately is just one too many. So with regards to patient privacy and confidentiality, we wanted to share with you HIPAA. This is a federal law. It stands for Health Insurance Portability and Accountability Act. So the examples of that would be telling friends or relatives about patients in the hospital, discussing health information in public areas of the hospital, discussing information over a phone in a public area, not logging off on your computer, or just even when you're home with the My Life, My Story, try and use earbuds or headphones so that information stays private. Infection control. So even though we are, having you do this virtually, this is just really information for you. So we encourage you to watch this short video done by ABC News on hand washing. So with virtual volunteering, we know that you have the responsibility to not allow your personal bias to cross over into your volunteer work and to know your limitations. We want you to be friendly, but not friends. Be consistent with your schedule for calling veterans. If we say that the appointment's set up for 2 o'clock, we want you to make sure you're calling at 2 o'clock. Your interviews can last anywhere from 45 to 60 minutes. We've heard some that have been, a little bit longer and a little bit less. But regardless, we want you to be mindful of their time and of yours. So some things that we want you to keep in mind is that, at this time, no one, our veterans and our caregivers feel that maybe no one really cares or understands about their feelings or needs during this time. There might be some underlying issues such as ongoing poor nutrition, financial concerns, or chronic sleeplessness. But even though you're doing the My Life, My Story, that you can still help bridge the gap of unmet needs just by listening to them and seeing what the veterans need. So some good listening techniques for the My Life, My Story. So you're going to watch a specific video that's also short for the My Life, My Story program specifically, but these are just some good listening techniques. We want people to feel at ease. We want to show that you're ready to listen. Remove any distractions. Don't doodle or shuffle your papers while they're talking. Turn off the radio or the TV. Allow plenty of time for them to tell their story and not to interrupt them. Ask questions and encourage them to show that you're listening. Accept what the veteran is saying, especially about their feelings. If their name is John and they go by Jack, call him Jack. Use a low and respectful tone of voice. Use short words and simple sentences, but don't talk down to the person either. Give them plenty of time to respond. And you can offer help by suggesting a word if you feel that they're struggling to find one. If during the course of the interview that you find that there's anything that doesn't feel right or sound right, how to report issues, so please contact voluntary service immediately. If the veteran or even the caregiver may answer the phone and they're looking for additional guidance or assistance, could be that their prescription's delayed or changes have been made to their living arrangements, just let us know and we'll connect with social work or the patient advocate department. If for some reason the veteran is avoiding your phone call, so we will be contacting them in advance, letting them know that you specifically are calling them. So if for some reason they're not answering the phone at the scheduled time, please let us know. If you're concerned about elder abuse, neglect, or suicidal thoughts, and if you're concerned that they may need some additional support for mental health or even spiritual help, we have a great chaplain service department. This is just for you to review in terms of your volunteer rights to be treated with respect and dignity by the veteran, the caregiver, to receive feedback on your effectiveness as a volunteer, to be able to receive and ask for guidance and direction from us. So I'll just give you some moments for you to pause this slide so that you can review it. Additional volunteer responsibilities: to treat the veteran and caregiver with respect, not allowing your personal bias to cross over, to be open and honest, calling on time for scheduled visits, and to keep all that information confidential for the veteran following the HIPAA guidelines. Again, some additional information that you can pause this slide to read and review. This is also a short video that we encourage you to watch. It is about other VAs across the country as to why they volunteer. Perhaps after this time of the My Life, My Story, there might be some other things that you would consider. We do have volunteers continuing on with the My Life, My Story. We have virtual wellness checks. We also have volunteers supporting the Project Happy Birthday Wishes and slowly rephasing volunteers back into different programs such as our Red Coat Ambassadors and My Life, and the Emergency Department. So things that we want to stress to you is communication. If you cannot fulfill your volunteer assignment at any point, please contact us immediately. We know people commit to things and then unfortunately things pop up. We want you to recall, remember, and to embrace patient confidentiality. If you have any questions or concerns, to call us or email us. And now we're going to ask you just to take a short post test that can be found on SurveyMonkey. Again, all of this time that you're doing for your training, we're going to be able to capture in your individual file, and then we'll be able to see the results on SurveyMonkey. Thank you for joining our team, and you're going to have an amazing experience as a volunteer. Thank you and good luck.